Hey, this is Doug Field, and welcome to today's webinar. We really appreciate you being here. We're going to wait a minute or two for everyone to join, and while we do, we're going to show you a little video of our most current forum held in December in Las Vegas, IHC Forum West.
Welcome. Glad to have you all here.
Imagine the world that people you interfaced cared about you.
Well, I like to think about how the consumer is now taking on a role that they weren't expecting necessarily.
And really, what is the vision of consumerism? I think it comes down to just this, that healthcare consumer takes more charge.
You have a chance every day to touch people's hearts. You have a chance when you leave here to go back understanding the real way to improve wellness in this country. We simply need to stop focusing on cost and focus on caring.
Again, my name is Doug Field. I'm the CEO of the Institute for Healthcare Consumerism, and I'm joined by my co-host and chairman of our advisory board, Ron Bachman. And we both are very pleased you've taken time out of your busy schedule to join us today for a guided tour of IHC Forum and Expo to be held in Atlanta May 7th through 9th. This really is all about you, so we ask you if you have any questions, to send us your question using the webinar questionnaire button, because at the end of this 30-minute webinar, we will do a 15 to 20-minute Q&A to try to answer most of your questions. Also, at the end of this webinar, we will make a very special attendee offer to everyone who's taken the time out of their schedules to join us today. Let me talk about IHC Forum and Expo, and really about the umbrella organization, the Institute for Healthcare Consumerism. For those of you who don't know us, we are the industry's information hub and collaborative community that is an outreach to well over 70,000 employers, brokers, advisors, consultants, TPA, regional health plans, and innovative solution providers in this business. Our goal is to really be the place that the industry comes together to learn, share, and connect. And that's the theme of our conference as well. The conference is really almost a human extension of what the Institute is all about. And we hold two of them a year, one in May that we're going to talk about, and then another in December. IHC Forum and Expo will approach 1,000 attendees this May. IHC Forum West, which is a year younger, will be about 500. So who attends the conference? Employers, brokers, advisors, consultants, and all of those that are interested in really getting their arms around what is happening with innovative health and benefit management and this healthcare consumerism megatrend. And I'm going to have Ron, our partner here, kind of give the definition of what we have as a mission around healthcare consumerism.
Thanks, Doug. The theme, the title of this year's Forum and Expo is Healthcare Consumerism, the Solution for Healthcare Reform. And, healthcare consumerism is a term that many people use. It's sort of a newly developed term that the Institute has been using for a long time as the industry has sort of come in the direction of utilizing more healthcare consumerism. But it may have different definitions for different people. So let me explain to the folks online the definition that we would use here at the Institute. Healthcare consumerism is about transforming an employer's health benefit plan into one that puts economic purchasing power and decision-making in the hands of participants. It's about supplying the information and decision support tools they need, along with financial incentives, rewards, and other benefits that encourage personal involvement in altering health and healthcare purchasing behaviors. Healthcare consumerism is independent of plan design. Many might feel that it is the account-based plans, the health savings account, the health reimbursement arrangements, and that's a critical key part of healthcare consumerism, but there are lots of different ways to encourage engagement and involvement of your employees. So healthcare consumerism really includes various ways and opportunities to accumulate funds through shared savings if you have an account-based plan. That is, plan members can be financially rewarded for doing the right activities that improve their health and save money. Rewards can include activities such as participation in wellness assessment, compliance with condition management programs, that is, things like taking your medications on time, diet, lifestyle, exercise, even office visits that you're keeping and maintaining proper schedules on for wellness activities or prenatal care. And it's about maintenance of good health characteristics, the biometrics, the blood pressure, cholesterol, nicotine use, body mass index, those types of measurements. But you know, healthcare consumerism has to work for all employees. It has to work for those that are healthy and want to stay healthy. It also has to work for those that are the sickest among us, so that it helps them get better, to stabilize their condition, or to actually go through some level of recovery. It has to work for people who are willing to sort of go online and learn and shop around healthcare options, but it also has to work for people who are too busy sometimes to do that, and so it has to give them the right kind of protection against catastrophic losses. So healthcare consumerism at the Institute encompasses all of those different aspects. So it's fairly broad, and there's lots of different ways to accomplish it, and that's what the conference is really going to be about. How do you actually apply all these principles and ideas to your own healthcare plan?
Yeah, so let's take a look at the agenda at a glance briefly, and then we'll dive down into the elements. Our event is the 2.5 day. It's expanded now to be a 2.5 day event, broken down into the pre-cons, which will be held on Wednesday morning, that we'll get into and kind of do a brief overview on those, and then kicking off with a major keynote on Wednesday afternoon that we're very excited about. Breaks into 4 different workshop tracks, 6 general sessions, and an innovation showcase, which is where our receptions, our luncheons, and where you'll find close to 100 innovators from everything Ron just talked about, you know, representing all the different moving parts of healthcare consumerism. Well, let's look at our speakers, because, you know, our speakers are really the heart and soul of this event. It's the peers, the employers, it's the policymakers, it's the thought leaders, it's members of academia that we bring together at this event. You know, except for those top 2 speakers, the rest of them have a lot of credibility.
You know, Doug, that's one of the really unique parts about the Institute for Healthcare Consumerism. We've got a core of people that we constantly add to as additional speakers, but the core speakers we have, some might call them faculty. We like to refer to them as our League of Leaders. These are people that are involved in their work at the policy level, at the legal level, at the economic level, that bring new information each time. So even if somebody has been to the forum before, and we get many repeaters, they'll see some of the same faces, but it'll be a continuous process of what's next. These are the people that are so currently involved in what's going on that they add real value. So we like to have them engaged, knowing about the Institute, what we're really doing, how it's working, and what the next steps are likely to be.
Yeah, the content is changing as fast as this industry is changing.
And, you know, you have to have people that are on top of it like that. We've got really some of the best industry leaders, national leaders that are out there, and they know what's happening, so they can bring the latest and greatest to all the attendees.
We try to make sure that the speakers that are with us are giving clear takeaways to you, the attendee. We think that's very important, to give you information and knowledge to take back into your organization. So let's go to the general sessions now, if we would. We're not going to read every word here because you can look at it quicker than we can, but I want to give you kind of a guided tour of our general sessions. And we're very proud of our keynote. We're bringing together, you know, John Goodman and Ken Thorpe. John Goodman, in many ways, is looked at as the father of HSAs.
He is.
He certainly is the free market, you know, thought leader. Ken Thorpe represents the other side of the street, and many think he may be Hillary's health policy advisor if she gets there, Ron. You know,
well, he was in 93 and 94 when Hillary Care was being developed. He was one of the first lieutenants out there, and I had the sort of the privilege of the insight to be able to work with him in 93 and 94 as an actuary providing technical support. So I know both of these players, and you know, their ideas on where we go from here, nothing's going to stay the same. We're going to go some way, right or left. We're going to move from where we are today, and we're going to get a unique insight. This is a little different presentation than you'll find at most forums, seminars, conferences. This is a real debate about where we're going. I know people come to say, what do I do next? What do I take back to my job for tomorrow that I start to work on? But it's important with such a big change going on in our industry to have these kinds of leaders that can give us some insights and awareness of what might happen. They're going to talk about where health reform goes, whether the next election goes one way or the other. Is it a free market approach, or is it more of a government-based system? Is it an extension to a single-payer system? Quite honestly, I don't think either of these speakers is all that enthralled with the current state. One would like to go to more free market, which is John Goodman, and Ken Thorpe would like us to go more towards single payer. So it's a real debate that's going on around the country, and we'll hear from the leading experts.
And this general session, like all general sessions, are built to provide for some very interactive question asking at the end of the session. There'll be up to 20 minutes or so of time at the end that you can ask direct questions to, to John Goodman and to Ken Thorpe.
You know, not only do we have some great general sessions here, but these are unique. You won't find these at any other forum. These guys, for example, their ideas have been batted back and forth in the halls of Congress, but we've never seen them on stage. We also have another very unique approach in the general session that's going to involve physicians, where the physicians are going to actually be talking not so much about health insurance reform, which is what we've experienced today, but health care reform. How's it affecting their practice? How's it affecting the care of employees that have to get back to work and their family members to be taken care of? We haven't really talked about that a lot as a country, and we're going to start seeing real practicing physicians talking about how all of this change in health reform is actually affecting the delivery of care. So I think you can get some unique insights from this panel.
Because we talk about it being about all the stakeholders. So by bringing the physicians and the providers into this picture, we're adding that other key stakeholder that an employer, a broker, a health plan needs to hear from and needs to be able to interact from, and that they need to hear from. I mean, I think the thing, Ron, that you and I were most excited about in meeting with these doctors is how interested they are at connecting with employers and the stakeholders that we represent.
Absolutely. You know, the other thing I'd say on these, I know we're not going to go through all of the general sessions here, but this is a good example on the compliance session that we have. That's where we have one of the so-called faculty legal leaders that comes through. John Goodman is great on the side. You know, I was going to say John Goodman is a great speaker on the and somebody who's been involved with on the debate side, the Healthcare Reform 2.0 debate. On the compliance side, John Hickman is a lawyer of great renown. He comes back each year and gives us the latest grades. There's nobody more tapped into what's going on in healthcare, on the legal perspective, than John Hickman. Oh, yeah. People come to the seminar many times just for him, because you get an hour or two of his advice, and then he puts on a workshop where you can ask him specific questions. That's worth the whole price of any admission and the cost of getting to the forum as any other part of what we put on here. He is just a great resource that comes back and gives us that time each year.
And when you look at the workshops, you know, John, the unique thing John agreed to do is he will follow this general session with a dedicated hour workshop all about answering your questions from the general session.
Yes.
What a price of admission that is, to have the ability to ask direct questions to John about some of these compliance issues. And that's not to, you know, Kevin McKechnie, who was the executive director of the ABA HSA Council, probably one of the most knowledgeable individuals on policy issues around HSAs. Where are HSAs today? Where are HSAs moving? How are HSAs going to come out of exchanges, you know, both public and private, as well as what's happening with full replacement HSA trends. So we're excited about that session because compliance is it. I mean, if you're not compliant, then you know, there's some real issues to face. The next one, there's a lot of disruption taking place with defined contribution and private exchanges. And, you know, we will not only, when we get to pre-cons, talk about a very dedicated, deep dive, 4-hour pre-con around understanding defined contribution exchanges, but here you see a general session where we'll have 4 of the leading exchanges. It'll be moderated by John Young, who is a member of our League of Leaders. We've invited lead from Buck. Chris Goff has agreed to participate. Chris heads up one of the more progressive employer coalitions and employer purchasing coalitions out of the state of Ohio, and he's coming in to represent the employer's perspective. Jamie Spriggs is CEO of Connect Your Care, very involved in the defined contribution piece, and really has a bird's eye view of quite a few exchanges and what they're doing. On the morning, on Friday morning, Dr. Wendy Lynch, who is one of the core speakers that Ron alluded to. I mean, Wendy is first of all, she's an engaging speaker.
Very good speaker.
And she really understands the business of healthcare consumerism and what it means to the employer and what it means to the individual. And she will head up a general session on creating better consumers of health and healthcare through improvements in plan design, transparency, and engagement. And she'll be joined by Janice Rahm, Executive Vice President of Interactive Health. There will actually be two other speakers here that we have invited. We're waiting to confirm right now. And then probably the most popular session of the general sessions we have is we close with 4 leading employers that give their perspective on where they are with complying, what their concerns are with ACA and compliance issues, where they are on the healthcare consumerism journey. And Jamie Benton is one of the leads that is going to be here. Helen Nelling of Wayne Farms. We've also invited the lead benefit director of Walgreens that should be here. She has been invited. And there'll be one other that we add to this panel. There's never a problem with filling out this panel.
It's a great panel. It's always been very popular. Employers hearing from other employers, that kind of sharing their stories back and forth, what's working and what's not. It's a great takeaway session that people really stay around for.
Let's go to the workshops, if we would. And again, we don't have the time here to go through all the workshops, but the key thing is our format. Talk about our format a little bit, Ron, our methodology with our workshops.
Well, again, the uniqueness of the IHC comes through in so many different ways. As we already mentioned, some that you won't find any other forum or structure that you'd go to for a seminar. Here, the workshops are set up in 3 very distinct profiles. Our mantra: learn, connect, and share. So in the learn area, you can get together in a forum where you're going to hear about solution providers. They're going to give you information. You can learn about what's going on. In the connect area, you'll go there and you'll connect maybe many times more to a client of a vendor, where you'll hear from the client what's actually happening. So it's not a sales pitch. We discourage that. You may hear a little bit more of that in the learn sessions, but that's why we describe them that way, so you'll know up front. You're going to hear product design in the learn session. You'll hear from people who actually implemented the different solutions in the connect session. And then the share sessions are probably the very most popular, because that's where the audience gets together and they actually start to share stories. You'll have a moderator or maybe a panel that will facilitate the discussion, present some ideas, but it's a great way to actually share. And the way I like to think about it, especially these days, when you put all those 3 together, the learn, connect, and share, it actually is going to help people figure out how to apply all these ideas and thoughts when they go back home. So it's all about actually implementing something, applying the ideas that you get, getting new leading ideas that are going to take your program to the next level.
And you'll notice as we scroll down through our workshops, and we don't have time to touch on every one, and people on this webinar can probably read faster than Ron and I and talk. But you'll notice some logos on there. I mean, we have worked very closely with a couple groups on our program. Georgia Health Underwriter Association has helped us develop the broker track, and a very unique employer-only group called Employers Like Me that we've embraced, and they're working close with us, is working with us on the employer content, developing the employer content, and working to supply speakers from their membership. So we've got, again, 4 different workshop tracks, and they will represent not just on the Learn, Connect, Share, but they'll touch on all the different areas, all the various subject matter around healthcare consumerism and compliance issues. Let's go to the pre-cons. Our pre-cons, really 4 unique pre-cons that we bring to this event. I'll talk about you know, the defined contribution and private exchange. And Ron, let you talk about your own baby, your certification pre-con. We've embraced on the defined contribution and private exchange one. We have working with us 4 leading employer groups from the Private Healthcare Exchange Collaborative, and PricewaterhouseCoopers working with us on building a 4-hour deep dive workshop that will really help employers and those working with employers understand all the different dynamics and models around private exchanges. Is a private exchange right for your employee population? If not, you know what maybe emerging solutions are. Where is the adoption rate across the marketplace? So New England Business Group on Health, Employer Health, out of Ohio, Midwest Business Group on Health, and Pacific Business Group on Health are these 4 employer groups in the collaborative, along with Pricewaterhouse, that's working on this program. Ron, talk a little bit about certification.
Well, again, I like to identify the way this conference is really unique from many others, and that is that we have this Making Healthcare Consumerism Work pre-conference session. It's 4 hours long. It's about a 250-page workbook that we'll go through in some detail. Obviously, even in 4 hours, you can't go through 250 pages. But we really put out all the essence of how you would look to the key issues around both principles and strategies and techniques to implement healthcare consumerism. And the really unique part of it is that at the end of the session, there is the opportunity to engage in getting a certificate for being a healthcare consumerist specialist, being a certified healthcare consumerism specialist. This, along with attending the general sessions, there will be a test that's available online that people can take and get certified. Now, it's not an easy test. This is not a gimme. This is an important certification that we believe we want people who really know and understand the concepts of healthcare consumerism to be certified. We will go through this. You have to go through this pre-con in order to really get the information. We will have it online, and you can take tests online. You can sort of watch a video of this if you want. It's an open book test, but it's not an easy test, so just being open book doesn't make it a gimme. It really takes some knowledge and understanding of the information that's going on, so that's very unique. The other one, I don't know if you touched on it that much, is the other pre-con is what we call a dose of reality. And again, we mentioned the general session where we're going to have physicians talking about the impact on their practices of healthcare reform. This is actually a 4-hour presentation with a lot more in-depth and both sides of the issue. We're going to have physicians who say, health reform is great, it's helping my practice, there's new opportunities out there. You got doctors that are taking the opportunity to change healthcare delivery with new approaches like telemedicine, some personalized services, healthcare apps. There's all sorts of things going on in the technology area that physicians are looking to utilize to expand their practices and actually do something different and better. But we also have, obviously, the physicians that are saying, no, wait, there's some real problems here. I can't get the medications. The formularies are too limited. I can't get my patients to the right hospitals because they're all out of network and they're too expensive. I can't deliver these services to my patients. So again, it's part of that debate process that's going to happen later in the afternoon after these pre-cons that this is a great build-up to. So if you want to really understand not just health insurance reform, as we've been talking about in the last several forums, but a much more focused area on health care reform, this would be the right pre-con for you.
Then we'll close the pre-cons and as a bridge into the keynote with a lunch and learn with presentation from both the Institute, but also Todd Berkeley with HSA Consulting and John Young with Consumer Driven, really talking about HSAs and what's happening with HSAs inside exchanges, inside and outside of exchanges. Let's talk a little bit about our partners, because some of the attendees may be members of some of these organizations. We have a tremendous outreach to partners, and we're very proud of the partners that have come in to support who we're all about, what we're all about, from the broker groups to both national and local broker groups, employer groups, pharmacy benefit, medical and domestic travel, thought leadership, think tanks like Leapfrog Group, MCOL, and the whole health plan arena. Health plans are really growth attendee group with us, on-site, off-site clinics, convenient care associations. So, you know, brokers our partners are part of we increasing our footprint to make sure both the Institute and the forum message gets out to more people, more places. Let's go to the Innovation Showcase. We're really proud of our sponsors. I mean, they're really the backbone of this event because they enable this event to happen on a cost-effective basis for attendees, first of all. But they really represent the innovation that's taking place in this space. Ron and I talk a lot when we're on our weekly radio program about tremendous innovation happening in this market right now. And, you know, we think we bring into our Innovation Showcase exhibit area a pretty good cross-section of the innovative exchanges, transparency, HSA, supplemental health, health management, wellness, you know, consumer decision support tool companies that are here in the market today. And the Innovation Showcase is where a lot of the entertainment activities will take place too, and where you'll have an opportunity through an exchange showcase to actually listen to exchanges giving a 15-20 minute presentation on their model. We're also bringing healthcare consumerism radio on site, where we'll be interviewing both attendees and our sponsors on our radio program that will be played throughout the hall and then will be available after the event. So where are we holding this? In our hometown, Atlanta, Georgia. And IHC Forum and Expo is going to be where it's been from its inception. It's the Cobb Galleria, which is a very quality, conference center, and the near northwest side of Atlanta, connected to a very quality hotel, the Renaissance Waverly. Also, walking distance across the bridge to the Sheraton. So 2 quality hotels, as well as our conference area. Again, it's May 7th through 9th. So how do you sign up to attend? It's our registration page. We have current early bird rate. You can see down there.